Hi, I'm Chris Denny's Executive Director of Results Canada. Results Canada is a grassroots citizens advocacy organization based in Canada, but a network of citizens who are focused on educating and raising awareness and taking action to end global poverty and needless suffering. We are in Bangladesh with a group of parliamentarians to lead an MP delegation here to look at what some of the big challenges are in this amazing country, but also to look at where the hope and opportunity is. We're going to have an opportunity to see microfinance programs and hygiene and sanitation programs and child survival programs, and I hope and know that we'll walk away inspired by the fact that even though there's a long way to go, we can create the change that will, in partnership with the countries and the people of this place, lift people out of poverty and create a better and more hopeful future.
So this is a regular forum. Everywhere this way the education is disseminating here, and also in this education forum one important thing we disseminate: how to wash your hands before you serve your food, before you cook, and also after coming from that, that cook anything. So this is very important because the study shows that most of the germs, it transmit from this type of, the child is given food just like immediate after not washing hands like this.
আমি এখন সাবান ছাড়া হাত দিলাম দেখি সাবান ছাড়া হাত দিলে কি পরিমাণ ময়লা হাত থেকে যায় হ্যাঁ
What we do, that the TB, when someone is found TB patient, normally that the 2 months is the intensive period, is the open cases. We say that whenever you cough, you keep a cloth on your mouth so it will not be spreaded. That after the 2 months, the Shastra collect the cough and again test in the laboratory and see whether the TB patients turn to positive to negative or not. If the patient turn to still positive, she, on the advice of our program organizer, our staff, she continue for 1 month more, like this, right? So, extension was. Otherwise, that after 2 months completion, what she does, she does continuous phase. That's 4 months. So she keep follow up this 4 months, and then after the completion of the 4 months, she take the cough again and test at the laboratory. If she found the patient negative, then she said that you are free from disease. So this is the area. Basically, that this type of smelling center, we have the different places. Basically, those who are the inaccessible areas, patient cannot come to the main center. So these centers basically help them. Today we are basically came to see one patient here, and the patient, how she identified, how the treatment is going on, and how the partnership is continuing. So that's all the things will be shared.
And she stays in her house in the village.
In the village. Please.
How does he know what medicine to take for his sickness? What medicine to take for his sickness? How does he know what to take and when to take it? I want him to tell me.
Every morning she takes the medicine.
Who gives him the medicine?
কে দেন আপনাকে ওষুধটা বলেন?
সেবিকা দেন
Okay. Usually these drugs are kept with the shebika. She will come in the morning to the shebika's house.
সে আইসা সকালবেলা মানে 7টায় উপস্থিত হয় উপস্থিত করে সেবিকা আমাকে ওষুধ
He is now feeling better and also his health, he has regained his health. Yeah. এখন কি আপনি কাজ করতেছেন? আগে কি
এখন হালকা পাতলা একটু কাজ করতে পারি, আগে তো করতে পারছি না,
একদম পারতেন না?
পারছি না।
When it was diagnosed, he couldn't walk, but now he can do something.
We visited the BRAC Center where we actually met with the women on the ground who are doing all the work. The work consists of working with other women in the villages, so we're talking about real people, so to speak, in the villages, working with them on health issues, and particularly tuberculosis, how to prevent tuberculosis, and when someone does catch tuberculosis, what to do, who to go see, what kind of drugs can you get, all the information that village people do not necessarily have.
Shanti is here for 11 years, and almost 30,000 people living here, and we divided the whole Shanti into 3 blocks with 3 delivery centers, each having 10,000 population. And the greatest challenge here we face is there's a lot of people here living, and the migration. In this area, the migration rate is 40%, 20% in migration and 20% out migration. So wherever we go, if we find a pregnant lady, because you know our program is about maternal health and neonatal health, so maybe the pregnant lady may not be there and the next month when we go for her. That's one thing. And another thing is people living here illegally, because this land is owned by the government. So most of the time they're evicted, and the municipal corporation doesn't provide water, sanitation, and gas, electricity supplies here. So it's really hard for the people living here to manage all those things for themselves. And you know, the health is not something about some particular thing. Health is everything. So these are the challenges we face.
In one day, I've just been overwhelmed with the way in which solutions are actually making a difference here in Bangladesh. And I usually go on these kinds of international excursions, and I'm overwhelmed with the magnitude of the problem, and I feel hopeless and helpless. But for the first time, I've actually seen things working. And I think because here in Bangladesh, with BRAC and with the Grameen Bank and other organizations, there's a philosophy of working from the ground up, helping people to help themselves, and approaching their lives on a holistic basis. So it's not a matter of, we know what's best for you and here's the solution, and make your, pull your socks up and get on with it. It's saying, what are the tools you need to improve your lives? And so the microcredit program helps families get some money and to explore new ideas and be creative, and gives them hope. And those same women are inspired by the volunteer health workers through BRAC, who in turn pass on knowledge to their children, and it's a circle that is producing results. And so I guess I'd leave here wondering how we can actually add to what's being done now, how we can build on this model.
Microcredit is not a problem of money. There's plenty of money in the world. It's not a problem. It's a problem of the legal structure. And you are the lawmaker, so it's very important for you. If you create the right law, money is no problem. But if you don't create the law, of course, money becomes a problem, because money doesn't get in. One way I express it, I say, we all live in ocean of money, but the poor people can't get a sip of that. That is the problem. So that's what the law comes, how you connect this ocean to the sea, to the people who don't get the sip. Grameen Bank lends out nearly $100 million a month. So that's what it does. Yeah, you can look at the figures. Yeah.
$100 million.
A month. And it doesn't take any money from anybody. It doesn't take money from the government, it doesn't take money from the donors, it doesn't borrow from anybody. So where does it money come from? Grameen Bank has 2,600 branches. What I'm saying, all this is in this book, Grameen Bank at a Glance. So each branch is required to mobilize the deposits around the area where they work. So local money comes into the branch as deposits, and they lend out to the local poor people. They don't ask money from us in the head office. We don't give money to anybody. We say, you are in business, you find your money. Don't come in. If you have excess money, then send it to us. Yeah. And all of them have excess money, so we mop up this excess money. So if it becomes $200 million a month, we'll still have the same money, no problem. And we will not go anywhere, oh, give us money because we are needing $200 million a month. So that's the money situation. So how Grameen Bank does it? Because Grameen Bank has become a legal entity as a bank. As a bank, I can take deposit. NGOs that you have been working with, they can't take deposit because law says you are an NGO, you can't take deposit. I said, why don't you make a law to create microcredit banks, tiny little banks, so that bank specializes in lending money to the poor people or lending money to the people who are rejected by the conventional banks. That's your only business. And your deposit is limited. You can take deposit only to the extent you lend money. Not deposit to take money and send it to some place and collapse because your big bank where you put the money collapsed, you collapsed. No, you lend money. Your entitlement to take deposit taking is to the extent that you can lend money.
I think what Professor Yunus stressed this afternoon, though, was the whole aspect of this being a hand up, not a handout. And he talked not only about the responsibility of society in helping individuals, but the responsibility of those individuals in completing their own accountability tasks. And I think that those two things have to go hand in hand. We can't look at just, and he said very clearly to us today, there's lots of money in the world. It's not a matter of money. There is lots of money available. It's a matter of helping people to reach those goals that they've set for themselves, their own dreams, and having that responsibility factor built into it.
I think that's true that we all, I think it's true that this is about giving a hand up. But we are dealing with some situations that require an investment. And what we should take away from this week is that investing a little bit in terms of eradicating tuberculosis or clean latrines and safe, clean water can go a long way to actually giving people that hand up and getting them out of poverty.
And prevention.
And Canada is a long way from reaching our basic millennium goals. 0.7%
coming back to Canada, can we say thank you to Results Canada, Résultats Canada? Can we say thank you? Thank you in the first place for allowing us to have this fantastic experience, but thank you for all the work that you did even before we came here to make us aware of this and the work that I know you're going to continue to do for quite some time yet. So thanks very much for all the help that you've given us and you've given Canadians.
There are a lot of people doing great work on the ground, and advocacy sometimes gets lost in the equation in terms of what it's all about. But I'll tell you something, the way I've started to think about it is this. You have these great people on the ground doing this work, and imagine it's like someone's drowning and they're providing the lifeline that's keeping them afloat. But advocacy and our grassroots and people that are like engaged Canadians who are making a difference, that advocacy is about, the sweep of tide that pushes those people to safe, dry land. It's the funding that gets the lifeline. So you need both parts of the equation. And, coming on trips like this where I can see how MPs are so changed by the experience and they're going to go back empowered and ready to take action, and that we're going to bring back these images and these stories and empower our citizens to become even more engaged and involved, just makes it all so worthwhile. I mean, it really just makes such a tremendous impact.